Yep.
Yeah. Go ahead.
So they wanted me to talk about Lyme disease. And I think instead of talking about Lyme disease, people, when you say disease, people think disease, that means there's, you're infected with one thing, you take an antibiotic and it goes away. However, we have not seen, sometimes that's the case.
If you catch it right away, sometimes.
If you catch it right away, or, it's part of the process. But you and I have both seen that Lyme disease, especially the cases that walk into our door that have not gotten better with the regular old course of antibiotics, there's something else. And the problem is that they're so sure that it's Lyme disease, and sometimes their doctor and their friends and the internet, Dr. Internet, has told them they have Lyme disease.
Dr. Internet, that's
Dr.
good.
Internet. There's lots of doctors on the internet right now. I won't mention their names, but they have their specific protocols for Lyme's, and they say that it works. And then they get a couple people on there saying how great it is. But I've reviewed them because I had somebody come in this week with one of the well-known people, and they were taking his supplements, and his supplements were basically all palliative care. There's a medical doctor who promotes Lyme disease treatment on his website, but he's still not getting to the cause. He's basically, there's one thing for adrenals, one thing for inflammation, one thing for microbial, one thing for enzymes, one thing for this, this, that, and the next thing. So it goes on and on. And that's basically a way of getting people on this palliative care for life and not getting to the root cause. So anyway, so that's my little rant on it. But the thing is that a lot of people have Lyme disease and are told they don't, but there's a lot of people that don't have Lyme disease and told that they are. So I think maybe the best, or one of the things that we should talk about, especially if I'm going to do a talk, is Lyme disease, what it is and what it isn't. And so
that's good.
One of the things that we can say is the things that imitate Lyme disease that we have seen in the office. Because a lot of people come in with things that are imitating Lyme disease, and Lyme disease may be part of it, it may not be, but they have a lot of other compounding factors. Okay, and what are they? Well, you're going to see metabolic syndrome a lot. Okay, a lot of people have metabolic syndrome that's actually, when I say metabolic syndrome, I'm saying blood sugar issues, blood sugar issues. When you test them on the body, you're going to see them usually in liver, adrenal, gallbladder, and B vitamin reflexes. But what they do, and on lab tests, you're going to see elevated glucose, HA1C. What else would you see? A lot of times elevated triglycerides. Sometimes elevated cholesterol, lowered HDLs. You're going to see in women waist over 38 inches and men over 40 inches.
Elevated blood pressure.
Blood pressure. All these things are metabolic syndrome. We've talked about this at length in our videos, so we can just reference that. But unless you get that under control, that's going to basically sabotage their immune system. And so if they have some kind of infection, it's never going to get better. The big thing with metabolic syndrome is it's going to cause inflammation. It can raise their HSCRP on blood tests. They can raise SED rate. Okay, both markers for inflammation. It can also, what was the other thing that it can raise? I think it's also associated with homocysteine levels. I'm not aware of any research, but I see the two go hand in hand in the office day by day. So that's the one thing, that's the first thing you got to get under control with any Lyme disease patient. Because if their blood sugar is off, it's going to create continual stress under liver, gallbladder, adrenals, B vitamins, and continual inflammation. That's one thing that people think, all right, well, maybe I have Lyme disease, and it can be that. That's one thing that people think it is, and it's not. You know what I'm saying?
Yes.
Yes. You have anything to add to that?
Well, I actually kind of want to ask an off-topic question slightly.
Yeah.
It's on topic to what you were just talking about, but off topic to Lyme disease.
Yeah.
I've seen a couple of women that have elevated blood glucose.
Yeah.
Yet, they watch their diet. They're not overweight.
Yeah.
They had gestational diabetes at least once.
Yeah.
You know, they don't eat too many carbs. They eat decent.
Yeah.
Like, what would you suspect there?
Oh, I suspect that.
Is that
everything?
Would you suspect perhaps another stressor on the system causing inflammation, causing the blood glucose to become
Yeah, why don't we
talk
go
about that
through
later?
these things? Because what you're looking at there is there's other things. Okay, so what would cause high blood sugar levels if people have the right diet? What other things would impact glucose levels?
Well, I think infections, right?
Infections, one. What else? And they're usually chronic, and that's the reason why the doctors miss them, because they're not totally like postulating. I mean, I hate to use gross terminology, but basically they're not postulating.
It's not an obvious infection.
It's not an obvious infection. They're not postulating, green ooze coming out of your ear kind of infection. It's more like that the person just doesn't feel well. And there's a number of them. It's not just from Lyme disease. There's chronic infection or chronic viruses. Morning. Chronic yeasts, other chronic bacteria. There's viruses, lots and lots of parasites. That's one thing that can raise blood sugar. So what's another thing that can raise blood sugar in the absence of bad diet?
Well, I'm not sure. Heavy metals? I don't know.
But probably some of the obvious ones.
Yeah.
High iron in the liver will do it.
Oh, that's why I have
That's why you and
slightly elevated.
We have a lot of patients that's it.
glucose.
Basically, they have high. Lift your feet when you.
Oh, sorry.
Otherwise, that's gonna. High iron in the liver will actually elevate blood sugar, and that's present. What have we found? About 1 in 9 people, but usually the patients that come to see us, especially if they have Lyme disease. Mm-hmm. See, that's the reason why I was saying maybe we should just get to this. The next thing that can cause, can imitate Lyme disease and can hide it is high iron. Did you know that?
It makes sense because the symptoms are similar.
Yeah, the symptoms of high iron, what are they?
Fatigue, depression, food sensitivities, joint pains, heart palpitations, other stuff, trouble sleeping. And then eventually over time, if you have it for decades, then it's going to start damaging your organs.
It's also going to raise liver enzymes levels, AST and ALT. It's going to raise blood sugar.
Primarily
blood test.
ALT.
Yeah, it's going to raise blood sugar, right?
Right.
It's going to raise cholesterol, right?
Yes.
It can suppress the thyroid, right?
Yep.
Yep. And also, it'll weaken the immune system so that the Lyme disease stays there. Got it?
Yes.
So that's one of the reasons why, when instead of just talking about Lyme disease, I want to talk about what is Lyme disease and what isn't. And I think we should talk about things that imitate Lyme's before we talk about Lyme's. So you got metabolic syndrome 1, elevated iron. Now the trick with elevated iron is, how do you measure that?
You have to get a iron panel.
And what's in the iron panel?
TIBC, UIBC, percent transferrin saturation, total ferritin, serum iron, and liver enzymes.
Okay, good. And so what does a medical doctor test on a routine lab test? If
Pretty
anything?
much nothing.
Pretty much
Maybe
nothing.
serum iron, probably not.
Right, and so how many people statistically carry that gene so that they're going to eventually get iron overload?
1 in 9.
1 in 9. Now, percentage-wise, what's the percentage of people that come into our office that have it?
I'm not sure. I'd like to actually do a study on this. But it's very prevalent. It is much higher than 1 in 9.
It's probably 1 in 3 I've seen. And I will tell you why. Because we don't see just people from the street. We see the people that are symptomatic.
Right.
We also see people that have failed in the medical system, right?
Right.
And so we're going to see a much higher number. So I have seen, when I test them and I run their blood tests, about 1 in 3.
Wow.
Okay? Yeah.
That's a lot.
Yeah. Yeah.
That's a big problem.
Right, so it's a big problem. So this is another thing. The other thing too is that if you don't take care of the iron overload and you're treating Lyme disease, does Lyme disease ever get better?
No. You're always going to be fighting it.
Yep.
You're never going to get ahead of it.
Yeah, so this is what happens, guys, is that your body knows that iron is extremely toxic, and so it sequesters it with different proteins and then the white blood cells so that it takes it out of the circulation so it doesn't kill you. But in doing so, it hampers the immune system. And so you're going to see chronic cases. A lot of chronic cases actually have it. So that's the second thing that will imitate, maybe not the second most common, but the second thing that you've got to rule out when you're treating for Lyme disease. Now, what's the third thing? You know what the third thing is? The third thing that I've seen,
Viral infections? No.
which will also affect blood sugar, are thyroid.
Thyroid.
You see this all the time. And the problem is that the lab tests, the gold standard for hypothyroid diagnosis. So the other thing that you were taught, or that I was saying, was another thing that can imitate Lyme disease is going to be thyroid. Now the problem is this, okay? With functional blood chemistry, you're going to see that the person's TSH, if you're just using that one thing, okay, their TSH should be between 1.2 or 1.3 and 2, okay, on the lab test. Now most lab tests will say it's okay until it's
4.5.
4.5. Now, I'll give you an example. So I had a patient that came in a couple weeks ago, and she had some symptoms. And when we actually lab tested her, her TSH level. That plane's really loud. her TSH blood level was 4.48, and so her doctor said your thyroid's fine. Okay, her symptoms were that she was kind of lethargic, she couldn't lose weight, she had high blood sugar, like I was telling you before. Mm-hmm. She was borderline diabetic. She had all these different problems, and you could see her thyroid wasn't working properly. Okay, now we can do other thyroid tests, you know, the T3, T4, T3 uptake, yada yada yada. We can do that, which will give us a better, quote, diagnosis.
It'll also show if it's an iodine deficiency.
It'll also show it's an iodine. So we do check those out. But what I have found works really, really well in the office, when you see a TSH that is elevated, okay, what you need to do is you need to check for tyrosine. You need to check for selenium, iodine, and then you need to check for it's called a PMG, protoneuronuclear extract of the thyroid. And that usually helps to give them tremendous symptomatic relief from their thyroid problems. Also, it tends to make them lose weight and get more energy. Awesome.
That's good.
Yeah, so that's another thing that can imitate Lyme disease. And a lot of people come in and they are, they're functionally, they've got, you know, a little like hypothyroid symptoms, but medically on their tests, they're, quote, fine, and they're told they feel fine. By the way, a lot of what we do with chronic stress, you know, this whole thing with intermittent fasting and keto and stuff like that can put a lot more stress on your thyroid because of the fact your body sees yourself going into starvation and that shuts it down. Also, what else was I gonna say? when you go into like keto and you go into intermittent fasting, your body actually secretes stress hormones, which will inhibit the thyroid. So that's why I always tell people, let's get you back to eating normal first, and then we can tweak your diet, rather than putting you on a severe diet that's going to throw off your biochemistry and hormones first.
Yes.
Okay. So thyroid problems are another thing that's going to imitate Lyme disease. Okay, you can look it up on, a more extensive thyroid panel, but we also couple that with muscle testing. And so, what's another thing that can imitate Lyme disease? Well, I will tell you.
Tell me.
Huh?
Tell me. The suspense is killing me.
Another thing that really will imitate Lyme disease is your plain old food allergy, quote, intolerances. And I would say more of an intolerance. Now, there are different types of food allergies and intolerances. There's IgE mediated, IgG, and IgA. Now, IgE are the ones that are real severe. Those are the ones that will kill you, like the peanut allergies, nut allergies, stuff like that. That's not what I'm talking about. If you have one of those, you probably already know it. Don't eat that stuff, okay? But there's the IgG and the IgA mediated blood tests. All right, I'm sorry. You can get it tested with blood tests, but I don't do that. I'll tell you why in a second. Okay? A lot of people actually don't digest things too well. Okay? And you can run blood tests for this. There's salivary tests for this. You can also muscle test for this. There's weaknesses in all of them. Okay, if you run a blood test, okay, they're not always that accurate. Okay, I've seen them be inaccurate. Okay, if you muscle test for them, that's great if you're eating the thing. If you're not eating the thing, it doesn't show up.
Sometimes it does.
Sometimes yes, sometimes it doesn't. So in other words, it's not always reliable. I hate to say that, muscle testers. Okay, I'm a muscle tester. Okay, muscle testing is great because it tells you what's happening at that point, but it won't tell you if you're not doing it. Like if you're not eating wheat, okay, and it's not in your system anymore, when you put it on the body, sometimes it won't show as being a weakness. Okay, so that's the second way of doing it. What I do is I put them on what's called a paleo reset, and you can look this up on our website. We talk about it extensively. We've also done videos on it. And where I got this information from was Chris Kresser, so I give him full credit. He's a genius when it comes to researching this stuff, and I think he's great. But anyway, I don't think he does muscle testing, but it's okay, Chris. Anyway, but what he says to do is basically do what's called a paleo reset. And the base of the paleo reset is that you eliminate grains, all grains, processed grains, all forms of processed sugar. Okay, processed sugar, I mean things like sugar, brown sugar, sucanat. I would even go away from the fake sugars like erythritol, xylitol, that kind of stuff. I would say stevia is usually okay. Fruit's usually okay, that type of thing. Just look it up on our website because we have this in there. So you avoid all grains, all processed sugar, and then dairy, okay? Now, when you're avoiding dairy, really the thing that is or allergenic is going to be the proteins, not the fat. So in other words, you're going to avoid yogurt, cottage cheese, milk. By the way, I see a lot of people are like addicted to yogurt. I'm like, yeah. Oh my gosh. You know why? It's because of the fact that they have certain allergens in there, one, and two, usually it's got sugar in it. It's like a cover-up. Anyway, but so you avoid all milk. You avoid all cottage cheese, kefir, yogurt, all these things. The thing, I would avoid cream just because it does have some of that milk protein in there. But what I would not avoid, in other words, what you can have, butter, ghee, those things, okay? Now just keep in mind, this is called a reset. And what it is it's getting all the allergens out of your diet. And you do that for a month, strictly. Don't fuss around with this because you need to avoid it strictly. IgG and IgA mediated immune system responses, they can show up for days. In other words, you might eat, or you might, have a glass of milk on Monday, and it doesn't show up as an allergen till Friday, or it keeps persisting as an allergen till Friday, or even next Friday. Okay, so you got to avoid it for a month. Okay, so you avoid those foods, all the grains, processed sugars, and dairy for a month. Okay, and then you'll see which things you're really allergic to. Okay, a lot of people will find that they're allergic to a number of those. And the problem is this too, is that if you don't do it like that, a lot of people that have non-celiac gluten sensitivity, 50% of them also have a sensitivity to dairy and they don't know it. That's why you avoid both of them.
Oh.
Okay? And almost everybody reacts to sugar. And there are some other reasons why sugar and carbs basically feed pathogenic bacteria in the gut. Which leads me to the next thing that can imitate Lyme disease, which is chronic infections. Okay, they can live anywhere. One of the favorite places to live in the gut. Okay, there's all sorts of different infections, from bacteria, parasites, I've seen viruses, lots and lots of funguses. These will imitate Lyme disease. They will create the same symptoms: joint pain, fatigue, depression. They'll show up in your blood test and elevated or suppressed neutrophils, white blood cells, and some other alterations. I don't want to bore you with exactly what goes on in the lab tests, but they'll show up there. Okay? And so the way that you handle that is with specific supplements, but you also handle it, like I said in step 1, with handling the blood sugar. A lot of people have blood sugar problems, and if you're eating too much sugar, actually it does not take much to feed these bugs in your gut. In fact, it takes, according to research, it takes about 30 grams of carbohydrates. In other words, if you're a person that's got blood sugar problems, you have more than a half a cup of rice, and you're feeding the stuff that's making you sick. That's one of the reasons too why you take out all the grains, the processed sugar, and the dairy, because that's where you get your excess carbohydrates that feed the bugs. Makes sense, right?
Yes, it does.
Okay. So I'm trying to think of other things can imitate Lyme. There's some other things which are a little bit less, how would you say, complicated to diagnose. Like, you can have low vitamin D level. That'll create tremendous amounts of fatigue and joint pain. Okay, and the thing is that functional blood chemistry says that your vitamin D level is supposed to be above, I think it's 50 nanograms. The problem is that the blood test, if you get it for a medical diagnosis of deficient vitamin D, they say it's got to be below 30. So between 30 and 55, you're going to have lots of symptomatic people. Okay, so vitamin D can do it. Another thing is a magnesium deficiency, and that will also show up on your blood tests. Okay, I will say that a lot of people are magnesium deficient. It goes hand in hand with that iron overload. And one of the telltale signs I see of people with magnesium deficiencies is some of the telltale signs. Sorry, I'm looking for my dog. Oh, there he is.
He's coming.
Some of the telltale signs are tight muscles, especially from the waist up, usually in the shoulders. Okay, that's number 1. Number 2 is usually they're a little bit irregular with their bowel movements. Okay, they say that unless they take something, they don't go every day. 3 is the feeling of tension and anxiety in the person. Those are the 3 things I see all the time. Okay, you'll see. In fact, I'll just test for magnesium. It tests like muscle testing, I'm saying. Even if I don't have a blood test and it shows up, you can almost always ask the person, do you feel a lot of tension in your shoulders? And they'll say, yeah. And you'll say, do you go to the bathroom, have a complete bowel movement every day? And they'll say no. Or they'll say, yeah, as long as I take this laxative. I'm like, that's not the point. Anyway, so magnesium deficiency will also imitate Lyme disease. Okay. Vitamin D deficiency will imitate Lyme disease. Trying to think if there's, can you think of anything else that imitates Lyme disease other than the blood sugar, iron overload, thyroid, food intolerances, other infections, vitamin D and magnesium?
Well, I will say that I've seen a couple people that have pain, tingling, burning pain in their feet.
Yeah.
They refer to it as a neuropathy.
Yeah.
And that can also be caused by heavy metals. But a lot of times they go together.
Yeah, and it can also go hand in hand with, I forgot that, it can go with a vitamin B deficiency.
Yes.
Big time. And the way we do that, you can have a blood test. There's certain markers on your blood test that will show that. One of my favorites is homocysteine. But what are the other things that show low B vitamins, which are telltale signs?
RDW.
What's that? RDW, which is going to be over 13. And what are the other things? The macrocytic.
It's a quiz, yeah. The size of the red blood cell.
Yeah, basically, if the size of the red blood cell on your blood tests will actually show, if they're too big, usually a B9 and B12 deficiency. And we just confirm it with muscle testing. And it works very, very well. You can also, you can muscle test the feet, put some homocysteine on there. If it goes weak, usually that person's going to have a B9 and B12 deficiency that if you take care of with supplements, their neuropathy will go away. You're also going to see lots and lots of B vitamin deficiencies in people with metabolic syndrome. So almost everybody's got metabolic syndrome. They're also going to have B vitamin deficiency. That's why you go after that first. That's also the most prevalent thing. So anyway, so is there anything else that you can think of that imitates Lyme's?
I can't think of anything off the top of my head.
You know, there's probably more things out there.
I'm sure there's more.
However, if you handle the things that we just went over, and listen, the best way to handle these things, okay, this is the most important thing, is by seeing a holistic practitioner that actually does do what's called functional blood chemistry. They run blood tests on you to give you a baseline of what your nutrient status is, okay? Number two, they incorporate the right diet. I have lots of people that go from functional medicine doctors to me that have been told certain things about their blood, but they didn't put them on the right diet. I mean, that is a fail. I mean, if you don't put the person on the right diet, it doesn't matter how many supplements they take.
Right.
You know, they won't get better.
Right.
And number three, they have to confirm and follow up with muscle testing. Because muscle testing, the problem is if you do functional blood chemistry, you may see, honestly, 20 things wrong, okay? But when you do muscle testing, you quickly realize that they can be 3 or 4 things that you really got to take care of, okay? And if you do that, the person gets better very, very quickly, okay?
Yes.
So anyway, thanks for joining us.
Yes, thank you very much.